Hi everyone, I'm Dr. Kaycee. I'm a skin doctor, preventive medicine practitioner, and the founder of Luminisce. And for today, we're going to talk about inner child healing or therapy. Because we're all aware that during the pandemic for the last 2 years, there's an influx of mental health problems like depression and anxiety. And we just want to know, how do you take care of your mind? So here I am with my guest, Miss Saps Uttam. She's a emotional and inner child therapist, and she's also an integrative nutritionist.
So, as a therapist, we are seeing, as you said a while ago, we are seeing the influx of cases such as depression, anxiety. People are really looking, for help. Help is really needed. People want to just talk to someone to let all their feelings out. Why? Because many people are looking for somebody to just hold space for them. So, what is inner child therapy? Inner child, we have a lot of inner children, and that's what we call pain body. It's basically more of emotions. And we've been holding on to our emotions. And what are emotions? There's joy, there's sadness, there's grief, there's anger, there's resentment, there's envy, jealousy, fear. These are all heavy emotions. And every single human being goes through it. We don't process our emotions very well because in childhood we're told, don't cry, otherwise, our elders kind of get angry with us when we cry. So from the onset of childhood, we suppress our emotions. And when we suppress our emotions, we think that's the way to go because we sweep it under the rug, and little do we know that later on it's going to come and it's going to manifest.
So, Saps, what are emotions?
So example of emotions are anything that we feel as human beings. Remember, we are all emotional beings going through this journey called life. Happiness is also an emotion. Joy is an emotion. But we don't talk about sadness, do we? We don't talk about grief. We don't talk about fear.
Anger.
Anger is a big one. Anger stays in the liver. And funny enough, they all stay in your organs. Anger, resentment, jealousy, rage, those are big emotions. Beneath anger is always sadness. And sadness is a big one. Grief is a very big one. Fear is a big one. All emotions are big, but we glorify, we talk about the happy ones. We don't talk about the ones that are, not worth talking, I guess. Or even when somebody cries and you ask them, how are you feeling? They wipe back, they hold back their tears. They kind of just brush it off and they're like, no, I'm okay. These are the emotions. And everyone has not just one, not just two, a lot of emotions all running at the same time. Fear, obviously, we want to know what's going to happen tomorrow. We want to know where we're going to be, what's going to happen. Do we have a job? Are we healthy? Are we okay? We're constantly thinking. The mind doesn't stop thinking at all.
Some people, they think that if they tell this to a friend or to a family member that they're going to be okay. But even if you tell your problems to a friend, it's not that fully okay. So you would like to know the importance of a therapies like inner child therapy or life coaching to be better, not only just going to the psych.
For me, holding space is very important because, first of all, for the person, they already feel like they're being judged. It's not about the other person, it's you. You're actually judging yourself. And when you talk to somebody, we always have to make sure that that person that we're talking to can hold space for us. More and more people cannot hold space because they're going through their own emotions. They're going through their own issues. So talking to somebody like a therapist is somebody that, yes, holds space for you, but also somebody that can guide you very well. And with inner child therapy is we get to the root. So it's always going to the past and seeing, did you miss anything there? What happened? Because you can't move forward without going to the past. That's your biggest clue because that's where everything starts. From not just childhood, maybe it happened when you were 10, 11, 12. And Once we start looking there, then we can understand why a person is the way they are.
We were discussing last time that to be able to be a good therapist, you need to be healed already. So, I'm curious, and I'm sure everyone is curious, what made you want to pursue inner child therapy? I mean, like, were you wounded before?
Yeah, I was in childhood. And I can say that with a very straight face because yes, I've healed that part of myself, but healing is always every day. You don't stop healing. Now, I may have dealt with that, but then I'm moving forward with ease and grace and learning to love myself. It's scarcity versus abundance. Everyone wants to be abundant in life, right? But abundance is not just money. Abundance is your health, your relationships. In order to have abundance, you cannot be in scarcity where there's lack. So when you're holding on to so much of your past, so much of issues, and you sweep it under the rug, you're mentally not or emotionally not welcoming for change. You can't say that you're abundant. You can't say that, yes, I am abundant, but there's something just pulling you back. And these are your emotions. It's pulling you back. Why? Because the body will do everything in its power to make sure that you don't go through hurt again. For me, the most important thing is heal yourself, because if you don't, you will start to snap at the people around you. And it's not their fault, but because you're tired. Why are you tired? The body's tired, your emotions are there, plus you're mentally exhausted. So when you care for yourself, you can then care for others. But if you don't care for yourself, you cannot hold space for anyone. Emotions are meant to be felt. And guess what? Your emotions are your biggest indicators to show you where you're stuck. For many cases, like for example, somebody tells me like, oh, you know, I have depression, just because they Googled it. And it's not really depression, it's really anxiety. And it's okay, it's fine. We will deal with it. But then we always want to make sure nutrition is also involved, because that's very important, because the body is starving for nutrients. Are you giving it enough B complex? Are you giving it enough magnesium? These are things that's very important because the body needs it. Are you hydrated enough? Because believe it or not, when you don't eat enough fruits and you already have the onset of depression, it can actually push you over the edge because the body is needing it.
What are the steps for inner child healing?
I guess first, book an appointment. Be, brave enough to say, I want an appointment. So when you come see me, you're going to have metaphor therapy. I don't want you to tell me your story. I want to see the drawing. It's a drawing. It's like, you're going to draw using colors. Very important for me to see that. Placing of colors, placing of everything. And then we tackle the subconscious mind, and I tell you what I'm seeing, and then we take it from there, and then we come up with a plan. It's a case-to-case basis. It's not the same for everyone, but metaphor therapy, that's for everyone. That's the standard. What is hypnotherapy? Hypnotherapy is putting the conscious mind down just to bring up the subconscious mind so that the files are exposed so that we can help. You can heal yourself. So that's hypnotherapy, but you can really hear yourself. You can hear what you're saying, what I'm saying. You'll remember it because it's like a movie. It's like you're watching it. You're like, Saps, I'm wearing shorts. I was 3 years old. It's like a movie. And then when you're done, go back to the conscious mind, bring down the subconscious. So it's beautiful. It's just the most beautiful process.
When do you tell the patient or the client, okay, we're done, you're healed?
They'll know. And can you really heal? You can't say you're healed. You'll say you've healed from that situation, and then now you walk into your beautiful future, which is yours to create in the first place. Because your future hasn't happened, but you can make it happen. It all depends on your mindset. It all depends on your mental well-being. So if you're carrying a lot of emotions, you're going to carry that till later on. Now, if you start to offload, then you'll be lighter.
when do you know that you need to refer to a psychiatrist?
During therapy, because then I hold more space, because obviously with psychiatrists it's more faster. But for this it's more of like, it takes a process, because I bring in nutrition as well. We check your mental well-being, your emotional well-being. We talk about your spirituality, where you're going to go from here, like your purpose, and of course nutrition, all 4 pillars of health. So it takes a little bit of time, but when you're ready, you're ready.
If you had a wounded inner child, do you think you can heal yourself
Of course. What's up?
without
You're-
a therapist?
That's very hard, because you wouldn't know how to access the subconscious. And there's something called ego. What is ego? Ego is a thin veil protecting your inner children. So you're going to have to go against that. So that's very hard. And all of us have wounded inner children. All of us.
So in order to heal, you need to lower your ego.
Well, not really lower your ego, but know where to look. Know where to look, and you need to know how to heal. But for many people, to be honest, and you and I are so close to each other, and we always talk about this. So many people, of course, if they can afford, then they see a therapist. But if they can't, then of course we always encourage them to look for, somebody that can help themselves, in the sense like, information is there. There's always information. If you look, you'll find. But if you want to start something, then start today.
So there are so many people claiming now that they're life coaches. So what is something distinct about your credentials with life coaches and other therapists?
Okay, so you have to be certified member of an institution. So for me, it's the IMDHA, which is the International Medicine Dentistry Hypnotherapy Association. I am a member. I've been a member for many years now. And every year we submit our cases, and then we walk the process, and then we renew our membership. It's very important. You can't hold space for somebody if you're not accredited. And then on top of that, IMDHA has a sister company called IACT, which is International Accreditations of Therapists and Counselors. So I'm a member of that as well. And then ACA, which is Clinical Hypnotherapy, and Integrative Nutrition. So all 4.
So guys, in the clinic, what we do in Luminisce, it's a holistic skin innovation, because we don't only treat the skin or pathological or aesthetic medicine. We treat holistically. So sometimes if the patient is not feeling well, feeling of bloatedness, fatigue, or even malaise, what we do is we evaluate the patient. Simple evaluation is to evaluate the tongue, the skin color, and then the actual mood. And then after that, if the patient is not feeling well, we might need to order some laboratory tests, like inflammatory tests, like your EPA-AAA ratio, or even you like the what test do you like? CRP. And sometimes what we do, we get the hormones just to check if it's balanced, and we correlate that with the heart activity, with your daily activity for 3 days, and even with your brain activity. Then after that, after assessment, what we do, we refer them to life therapies and inner child therapies like Saps and integrative nutritionist. So for Saps, I referred some patients, and I would like to follow up. How are the patients now?
No names.
No names.
So I have no words, but remarkably well.
Yeah.
And it's kind of like helping the family as well, the children. And it's so nice when somebody comes to you and they're early for therapy. Let's say therapy's 10:30 and they're there on the dot. They value their time. And it's like, the children say, oh, this is mommy's time for therapy, Self-care, self-love, very important. Happiness is within. We seem to have lost it along the way. So they're finding their way back to themselves.
What do you recommend them if the friends or family member is not ready for therapy?
It's okay. If they feel that they're not ready, then they're not ready. You can't force anybody to come to therapy. No matter if it's bothering you, though, then my question would be for you. What is it bringing up in you? So for me, when a person's not ready, they're not ready. You can't force them. But when they're ready, I think they will come.
One last question.
Go ahead.
So, what do you tell to your inner child, like an 8-year-old inner child? If you're going to talk to your inner child, 8-year-old inner child, what are you going to tell
Well,
her?
it depends. Did the inner child go through pain? If they did, then I'm sorry that you went through it. I'm here now. I'm here for you. I love you. Nothing wrong with actually telling your inner child that you're sorry. Nothing wrong with saying I love you. You are saying it to yourself after all. So I'm sorry that you went through whatever it is. I'm sorry that life was difficult. I'm sorry that I wasn't there for you. Please forgive me. I didn't know any better, but I love you. You are me. I am you. And just feel that. Just feel that in your chest. Feel that in your heart. And start there.
Thank you, Saps, for that. Thank you for letting us know about inner child healing and inner child therapy.
Thank you for having me.
If you want further learnings about inner child therapy, you can book Miss Saps from our hotline. You can contact us, and then we're going to book a consult with you. So guys, if you like our learnings for today, please don't forget to like this video, subscribe to our channel, and hit the notification bell for further learnings from me and from Luminisce.